I'm Krista Michener. I'm a nurse practitioner who works in Worcester, Ohio. I own a clinic called AHP Integrative Health. Originally, the AHP came from, we started as Affordable Healthcare Partners, but we've kind of evolved as we've taken on more and more integrative medicine, and the AHP is now a healing place, is what we use that to stand for. My mission is to help everyone achieve optimal wellness. My tagline that I sign, that's on my wall, I sign all my notes, it says, "Have hope, you were made to be whole." So that's what drives what we do, finding answers to help people achieve optimal wellness and wholeness.
What sort of patients does AHP see?
Okay, so we see patients of all ages. I personally just see 13 and older. So we are primary care, but we mostly see people with more complex conditions. We like preventative care, but a lot of times by the time a patient comes to us, they've seen a lot of specialists, a lot of other providers, and are looking for answers. I do treat Lyme disease and related infections, and as we've done that and word has spread, that occupies a huge part of our practice. Probably about 80% of the people I see have some sort of chronic insect-acquired infection.
Let's talk about that a
Sure.
little bit more. So you see a lot of people with Lyme
Mm-hmm.
or insects related. What do you find about these people that's unique and the challenges that they're having?
Well, the challenge is most of them have been through a series of misdiagnoses.
You need to start with the challenges.
Oh, because,
Yeah.
okay, yeah. The challenge with treating someone who may have Lyme or Bartonella or Babesia, some associated infection, is that typically by the time we see them, it's multisystemic. They have symptoms that affect their quality of life, that affect most of their body. Many of them have been to multiple other providers and had missed diagnoses. And a lot of it just falls under this one umbrella, is we have infections that, because, for example, Bartonella and Babesia are in the bloodstream, they can affect anywhere that blood flows, and that's pretty much everywhere. So it is challenging because of the number of body systems are involved, but rewarding because instead of dividing someone into, here are your urology symptoms and your dermatology symptoms and your psychiatry symptoms, here are the symptoms of your infection, and then we're going to go back to that to get all of these other systems working well.
Do you have any stories you could share of patient stories?
Well, a personal story, when I started learning about this and diving into it because of a complex patient I had that I felt like they hadn't been given the right answers, I started to realize that this really resonated with my family's experience. I thought, this has got to be what's going on with my kids. I have 6 kids, 5 biological, and as I walked this path, we learned that I had Bartonella and Babesia and gave it to all of them in pregnancy. And so the mental health misdiagnoses that we've had, the suffering that they've endured for a very, very long time. Our oldest son was told that he should go on disability when he was a teenager. He's now 26. He actually works for our practice during neurofeedback. He has another part-time job. They're all healing. And so that's what drives me to learn more so that I can help my family heal and then share what we learn with others so they don't have to walk that same path.
Very good. How does genomics fit into your practice?
Genomics is amazing because I actually learned about it from some other professionals who said, you know, if you have a really tricky patient, you really, really need to dig into the genomics. And what I've found is, you know, with complex illness and with the human body, we're just putting together lots of pieces of the puzzle. But it's like you're putting together a puzzle that has missing pieces. And genomics provides so many missing pieces. And the thing that's super exciting about it, it's so affirming to our patients because, you know, when I have them send in a sample nobody knows what their diagnoses or symptoms are, but invariably what comes back on that report affirms everything that they've been experiencing. They're not having brain fog because they're not smart or they're not trying enough. They're not having anxiety because they don't have enough faith, this, that, or the other. Their symptoms always line up with what genomics predict as a risk. So it's really affirming. And then the better part is it's actionable. It's not just, oh, you have this genetic problem, good luck. It's, here's what we see in your genes, here's what you can do to work around it. So it's very, very hopeful.
You probably looked at other genomic tools. How does IntellxDNA compare?
So I love Intellx because, first of all, it's very comprehensive. There are a lot of other tests that don't provide the breadth of data. But the other thing that I love about it is it's not just a puzzle for the clinician to solve and understand, and then the patient is at the mercy of the clinician to give them all of that information and the interpretation. They literally have a guide that they have for the rest of their lives that gives them actionable items for each SNP. So I tell them this becomes like your Bible or your roadmap that you get to take with you on the rest of your journey, and we can refer back to constantly. So I used to think it was expensive. I've now decided that it's worth every penny, because the money and time that you save by having this data that's never going to change, but that can help you shape the rest of your life and your health journey, is just invaluable.
Thank you for that. You're here at the conference. Tell me about your experience.
So this is the first Intellx conference I've been to. It's been fantastic. And one of the things I actually love is that there is no CME credit, so we can get practical advice. I get frustrated sometimes. I spend a lot of time and money and energy going to learn, but you don't always get practical advice. So everything we're learning, we're getting hands-on ideas, collaboration for things I can take. And when I go home on Monday, I already have patients in my mind that I'm going to do new things for because of what I learned.
Just thinking about the types of patients coming to your website, looking about,
Sure.
about you. Two questions I'm going to ask. What does it mean to be an integrative provider?
So an integrative provider, I describe it to people as we take the best of both worlds. You know, some people think medicine and Western allopathic medicine has all the answers. Some people think that natural modalities are the only thing that are good. And I think there's good in both. And I think we're really blessed to live in a time when we have both available. So that's what integrative medicine does. We look at the individual, their preferences, their health, and then what's available to us through both modalities. And we take the best from both worlds and create a plan for optimal healing for that individual.
What advice would you give integrative physicians that haven't yet done genomics? You need to.
Okay, the advice that I would give for integrative clinicians that haven't yet done genomic testing is this should be at the beginning and not the end of your to-do list. You know, I have patients who we've done so many other tests that gave us valuable information about nutrient status, GI health, toxicities, but this is what turns the key for all of those pieces to come together. So it does no good, for example, to know that they're low on B12 or D, but not to realize that, oh wait, they can't absorb B12 in the gut and their D receptors are impaired because of this genetic variant. It's absolutely invaluable. It's affirming to patients, and it can make everything else you do more effective, and you'll have quicker, better outcomes for your patients.
I said that was the last. I'm going to ask one more.
Okay.
On your website. Tell me a little bit of how you got into this.
So how I got into this was, I think, divine intervention. I was working for a primary care practice. I felt really guided to open up my own practice near my house, which was quite a bit of a stretch. You know, NPs don't have full practice authority in Ohio, so it took a lot of hoops and maneuvering and financial risk. But as I did it, I was blessed to be introduced to people who introduced me first to nutrient testing. And because of that, I learned about neurofeedback. And because of that, it's just this domino effect once you step into this world. And I realized, wow, the traditional medical world is built on treating chronic illness but not healing people. And there's so many things that I've been told and taught aren't treatable, but they are. There's so many ways that we can find healing, and I can be a part of this. So that's how I embarked on that path, and just keep learning as much as I can.
Anything I didn't ask that you wish I had?
Do you treat children? Because then okay. I don't personally treat children under 13, but I do have a nurse practitioner who does, Rachel Leidy. She works just by telehealth because of her location, but she practices integrative medicine too. She treats children with Lyme and associated illnesses, so she's available to take care of those patients.
Krista, you're natural.
Thank you. Thank you. Oh, I'm not still.